Just a little
Okay.
bit more force. Yeah. Okay, we're good now.
We're good?
Sorry.
Round two. Okay. When you think of a psychologist, what's the first thing that comes to mind? A therapist, a shrink, maybe even a black leather couch? Well, today I'm going to tell you about my dream job, a clinical psychologist. I will begin by telling you all about what a clinical psychologist is and what they do on a day-to-day basis. Then I'm going to tell you about the different clientele they work with and specialize in treating. I feel very comfortable discussing this topic with you because I've done extensive research on it and have dreamed of becoming a psychologist for many years now. So let's get started and discuss what a clinical psychologist is and what they do. American psychologist Leitner Whitmer first introduced the term in a 1907 paper. He was a former student of Wilhelm Wundt and defined clinical psychology as the study of individuals by observation or experimentation with the intention of promoting change. That description hasn't really changed over the years, and in a 2013 American Psychological Association journal, it defines a clinical psychologist as a doctor whom assesses, diagnoses, predicts, prevents, and treats psychopathology, mental disorders, and adaptation. Today, clinical psychology is one of the most important subfields of psychology. In 2012, Professor Janet Rebstein, a psychologist who specializes in family and couple therapy, wrote an article published in Guardian Healthcare Network about a day in the life of a clinical psychologist. Rebstein tells us all about her daily life and the different experiences she goes through as a clinical psychologist. Due to time's sake, I'm going to shorten her story and give you the basics on her daily routine. She lives in London and starts every day off bright and early at 6:30 a.m. First order of business is always her clients. She works in a joint practice with a bunch of other clinical psychologists that specialize in other fields. She's also a professor at a nearby university, where she teaches new and upcoming psychologists on how to do their job. As if patients and teaching is not enough, she's also helped create the Avon Breast Report, where she helps analyze patients who have been diagnosed with breast cancer and their family members and how they deal with cancer and everything. Rebstein proves that there's so much more to being a clinical psychologist than just sitting on a couch talking to someone about his or her problems. So, now that you know what a clinical psychologist does, let's talk about the different clientele they work with. Clinical psychologists have a wide range of clients. In a 2012 journal article published in the International Journal of Psychology Studies, Rajendra Misra and Sabine Ritzky have analyzed that a person who is qualified to be a client depends on the setting, the role, the interest, and the training of the particular psychologist. In a private practice that focuses on life coaching, a broad sample of the general population would be seen, so like you and me. In an educational setting, the students and the teachers would be the people that would most likely be the client. In a hospital environment, patients with psychological issues affecting their physical health might be the main focus. So as we wrap up our time together, let's go over one last time what we discussed today. We started off talking about what a clinical psychologist is and what they do on a day-to-day basis. Then we discussed the different clientele that they treat and specialize in working with. So the next time you hear about a clinical psychologist, don't immediately think that they are just some shrink that sits on a black leather couch focusing on someone's problems. Thank you.
3:10 was your time.